I'm David Gilligan. I'm a consultant oncologist in Cambridge, and I specialise in the treatment of lung cancer. It's really important if we can to detect tumours early, because the earlier we detect them, the more successful treatment is going to be, and hopefully a tumour picked up early will be a tumour cured. In the last few years, lung cancer management has really mushroomed in terms of the treatments that are available to people. Massive amount of work looking at surgery which is less invasive. So keyhole surgery, sometimes called VAT surgery, is used much more widely, and that is associated with much less pain, much better healing, smaller scars, less time in hospital. The other treatments, such as radiotherapy, they have become much more able to focus the radiation beam on the tumours. Treating people with combinations of radiotherapy and chemotherapy have become much more common. And then finally, looking at treatments to treat widespread or advanced disease. In addition to standard chemotherapy, we now have many more options for treatment, including immune therapy, which allows the body's immune system to attack the cancer. And also for people who've got very special types of lung cancer, there are treatments, usually tablet treatments, which are targeted against specific abnormalities if the tumour has that, which are, first of all, very effective, and B, usually associated with less side effects. For many people who respond, their life has been transformed. There are many safety measures which have been put in place because of COVID. For instance, we all wear face masks in every area of the hospital apart from our offices if we're just working alone. To get into the hospital, you have to show that you either work here or you've got an appointment. You are encouraged to either sanitize your hands or wash your hands when you come in, and you may be asked to you may have your temperature taken. Anyone who might have symptoms has to come in through a special pathway. So the hospital have worked and reconfigured areas so that people who might have COVID, in the broadest of terms, will come in a different way, or different entrance, different doors, to people who have no symptoms at all. The hospital have made massive changes to the way they work and to other areas. So there are designated areas. So as you say, it's as safe as it can be. Certainly in Cambridge, and speaking to other colleagues in other parts of the country, by and large, treatments weren't stopped. They may be modified, and nationally, there's a lot of experts we got together at the beginning of the pandemic to make recommendations so that if treatments were going to be much more difficult just because of the load of people in hospital with COVID, that we could make sensible and safe adjustments to treatment. By and large, the majority of treatments continued during the COVID pandemic, and I'd say they're almost back to normal at the moment. Clearly, it's a situation that can change, and if there is a second wave, then we may need to look at things again. But people have gained a massive amount of experience in looking after people with COVID now, and so there are changes and processes in place so that if there is a second wave, people will be treated with COVID, and hopefully we won't have to make the radical shutdown of the NHS that was anticipated with the first wave. If you think you have symptoms of lung cancer, and let's face it, some of the symptoms might overlap with symptoms of COVID, you need to take action. I think that's the important thing. Don't be frightened. And your GP may not see you face to face. They may do it by telephone or by video, but I think you have to be persistent. If you are concerned about your symptoms, see it through and pester your doctor. You may have to speak to them more than once, but get an X-ray or get an appointment at hospital to check that there is nothing serious going on.